I spent over 2 decades as a cardiovascular surgeon watching something that troubled me deeply. Patients following their blood pressure guidelines to the letter would return months later struggling with dizziness, chronic fatigue, and sometimes conditions far worse than when they started. What I discovered about the recommended blood pressure targets for people over 60 completely changed how I approach senior health, and by the time you finish watching this video, you'll understand why the number your doctor aims for might actually be working against your body's natural needs. Recent clinical research involving thousands of older adults has revealed something extraordinary about how our cardiovascular system functions after age 60. When researchers pushed systolic pressure below 120 in seniors, they documented alarming patterns of falls, kidney complications, reduced cognitive function, and dangerous drops in cerebral blood flow. Blood pressure is the driving force that delivers oxygen to every vital organ in your body. In aging bodies with naturally stiffened arteries, pushing those numbers too low can paradoxically reduce circulation rather than improve it. The breakthrough came when scientists compared outcomes across different blood pressure ranges. Seniors maintaining systolic pressure in the mid-120s to low 130s with diastolic readings in the 70s demonstrated fewer strokes, superior balance, and significantly higher energy levels. This range keeps blood flowing efficiently without straining delicate vessels. Today I'm sharing 5 scientifically validated methods you can implement immediately to optimize your blood pressure naturally and safely. The second method comes from a clinical trial where older participants reduced their pressure without increasing medications while simultaneously regaining mental clarity. All medical studies and sources referenced in this presentation are available in the description below. Now let me ask you something. Where in the world are you watching from right now? We read every comment and respond to create a supportive health community for everyone here. The 5th most effective approach completely contradicts conventional advice about salt intake. Cutting sodium too drastically after 60 can trigger dangerous blood pressure instability that puts you at risk. A European Heart Journal study following over 10,000 seniors found that moderate salt consumption between 2,000 and 3,000 mg daily produced better cardiovascular outcomes and fewer hospitalizations compared to restriction below 1,500 mg. Your aging kidneys process sodium completely differently than younger kidneys, requiring a precise balance of sodium, potassium, magnesium, and calcium. When seniors cut salt too aggressively, their bodies cannot maintain proper fluid balance, leading to orthostatic hypotension, that lightheaded feeling when standing that causes thousands of devastating falls annually. The mineral matrix approach works with your body's natural rhythms rather than against them. Begin each morning with 1/4 teaspoon of high-quality sea salt or Himalayan pink salt dissolved in warm lemon water. This morning ritual helps your adrenal glands produce optimal aldosterone levels, the hormone regulating blood pressure throughout the day. For every 500 mg of sodium consumed, pair it with approximately 1,000 mg of potassium from bananas, sweet potatoes, spinach, or avocados. Timing matters enormously for mineral consumption. Consume most salt during daylight hours when cortisol levels naturally peak and your body processes sodium efficiently, then reduce intake after 6 p.m. to prevent nighttime fluid retention. Include magnesium-rich foods like pumpkin seeds, dark chocolate, and almonds with salty meals as magnesium acts like nature's calcium channel blocker. Don't fear naturally salty whole foods like olives, pickled vegetables, or aged cheeses, as these contain cofactors that help your body process sodium properly. Monitor your response by noticing how you feel when standing from a seated position. Before we continue, make sure to hit that subscribe button and turn on notifications because what comes next could change everything you thought you knew about managing blood pressure naturally, and you definitely don't want to miss the remaining methods that work even better than this first one. The fourth method involves a specific breathing technique that Japanese researchers discovered can lower systolic blood pressure by up to 15 points in just 4 weeks. This isn't random deep breathing but resonance breathing at exactly 5 breaths per minute. When you breathe at this precise rate, inhaling for 6 seconds and exhaling for 6 seconds, the pressure sensors in your carotid arteries literally recalibrate to healthier baseline settings. A Veterans Administration study tested this protocol on over 2,000 older veterans with resistant hypertension. Those practicing twice daily for just 3 minutes each session achieved average reductions of 14 points systolic and 8 points diastolic after 8 weeks. Aging naturally reduces baroreceptor sensitivity, which is why blood pressure increases with age, but this breathing protocol reverses this decline. Sit comfortably with both feet flat, hands resting on your thighs, and breathe in through your nose while counting 1001, 1002, up to 1006. Exhale through pursed lips for the same count. The pursed lip exhalation stimulates the vagus nerve, your body's main parasympathetic pathway that directly lowers heart rate and blood pressure. Practice 3 minutes immediately upon waking when cortisol naturally spikes, and again 3 minutes before bed to prevent nocturnal hypertension. You'll know it's working when you feel a warm tingling sensation in your hands and feet during practice. The third most powerful method revolutionizes how seniors should approach hydration. UC San Diego researchers discovered that when you drink water matters more than how much you drink. The sensation of thirst decreases by up to 40% after age 60, and this subclinical dehydration forces your heart to work harder. Drinking exactly 16 ounces of room temperature water precisely 30 minutes before each meal can lower systolic blood pressure by an average of 12 points within just 2 weeks. Your blood plasma is normally about 92% water, but in dehydrated seniors it often drops to 88%. That 4% difference increases blood viscosity enough to raise blood pressure 15 to 20 points. Start your targeted hydration protocol by drinking 16 ounces of room temperature water immediately upon waking. Room temperature is crucial because cold water causes temporary vessel constriction that can spike blood pressure for up to 30 minutes. Add 1/4 teaspoon of Celtic sea salt to your morning water if you experience dizziness when standing. The second most effective method involves revolutionary exercise that takes only 9 minutes 3 times weekly. Isometric resistance training means contracting muscles without moving joints. A Mayo Clinic landmark study on adults over 65 found average blood pressure reductions of 14 points systolic and 8 points diastolic after just 8 weeks. During an isometric hold, blood flow gets temporarily restricted, and when you release after exactly 2 minutes, the sudden rush triggers massive nitric oxide release. The scientifically proven protocol involves 3 exercises: the wall sit, modified plank, and hand grip squeeze, each held for 2 minutes with 3 minutes rest between. The most powerful method comes from a 20-year Finnish study following 3,500 older adults. Those practicing regular cold exposure had 50% lower hypertension rates and lived an average of 6 years longer. Controlled cold exposure causes blood vessels to rapidly constrict then powerfully dilate, maintaining their flexibility despite aging. Johns Hopkins researchers had seniors immerse hands and feet in 50-degree water for 10 minutes daily, achieving blood pressure drops of 18 points systolic within 6 weeks. Begin by filling a basin with cool water around 65 degrees and immersing your hands for 30 seconds twice daily. Every 3 days lower the water temperature by 2 degrees until reaching 50 degrees. The optimal blood pressure range for seniors is 130 to 139 systolic over 70 to 79 diastolic. This represents a fundamental shift in medical understanding based on studies involving over 100,000 older adults worldwide. As we age, our blood vessels become less elastic and our brains require more pressure to maintain adequate perfusion. The 130 to 139 range provides enough pressure to push blood through less elastic arteries while ensuring adequate perfusion. Your journey to optimal blood pressure starts with implementing just one method this week.